I felt like the drugs had their hands wrapped around my throat, and if I tried to leave, I'd die. I know that if I ever relapse, I'm not going to make it back. This is my one and only shot. If you're reading this, you can make it out too. Shelly Daly, 21. She's only a year younger than I am, so are a lot of other kids on the website that share their story in an article written by Jennifer Harlan on the New York Times titled, "You Can Make It Out. Readers Share Stories of Opioid Addiction and Survival," dated December 27th, 2018. Well, I want to ask, do any of y'all actually know how easily you can become addicted to opioids, or what an opioid really is? Well, an opioid can be anything from heroin, morphine, codeine, oxycodone, and many more. And if you or your loved ones or anybody you know has these in their medicine cabinet, you are as easily at risk at becoming addicted to them as anybody else. That's what happened to my cousin Morgan. She went from being someone that was lost, fragile, and addicted, and someone I truly didn't know, to being the most loving, caring, and greatest success story around. But I've also seen the complete opposite. Families that we grew up around, they didn't have that recovery or success story, but instead they lost someone that they loved. Having that affect people so close to me has made me passionate about a topic that's so little known about, but that is so important that we need to face. That's not only affecting our nation, but our community as well. It can affect each of us, just like it did my cousin and our family friends. Some steps that we could take is to understand how large of an epidemic it is that we're facing, how we can be a part of the solution, and why it's important that we face this, and my challenge for each of you. So what is the opioid addiction crisis, and how large of an epidemic are we actually facing? I found data in an article written by and published on the National Institute on Drug Abuse titled Opioid Overdose Crisis, published April 17, 2020. Did you know that in 2018, 1.7 million people suffered from a substance disorder? Out of those 1.7 million people, 46,802 Americans died from an opioid overdose. That leads us to 128 people dying on a daily basis from an opioid overdose. 526,000 people suffered from a heroin disorder. 80% of people that use heroin first misuse prescription opioids. Now that we understand how large of an epidemic it is that we're facing, now we can learn how we can be a part of the solution. After looking at many websites and talking to my cousin, I saw the same thing repeating, that the key thing to solution would be awareness and education. I talked to my cousin and she said there needs to be some kind of warning from physicians and pharmacists. They need to educate people before they put them on it, which agrees with the practical steps that we can take and expected results that I found in an article written by Leslie Ray Dye, MD, FACMT, on medical economics titled Education is the Key to Stop Opioid Abuse, published June 21st, 2019. Practical steps are to require education on addiction, educate the public on resources, to require addiction medication or medicine instructions to not only healthcare providers, but also to require it in the curricula of any medical student. And lastly, to provide training on addiction medicine. If we follow those practical steps, we can see some of these results. If a pediatrician understands that the family is at risk of being addicted, the family history shows that they're addicted, they can become addicted, then they can educate the family so that they can prevent that. Healthcare providers can address this like any other disease and disorder, and it can reduce the stigma. If our family and loved ones understand it more, they can help us reduce the stigma. And also, medical workers and our community will understand what resources that we have available. Now that you understand how large of an epidemic that it is that we're facing and how we can be a part of the solution, I'm going to share with you why it's important that we face it. If each of us do not do our part, the numbers are only going to increase. And it could be you or a loved one saying what Frank Chioffi told Tadashima Nasrullah in an article on BuzzFeedNews.com. Families write moving online memorials for victims of the opioid crisis, October 18th, 2018. In this picture is Frank Chioffi and his daughter Alexa and Alexa's son Frankie. I screamed her name, she didn't move. So I shook her, she didn't move. I think Frankie heard me scream. Alexa Rose Chioffi died from overdosing at the age of 30. If each of us instead take a step and we do our part, then we maybe can see more success stories, not only like my cousin, but Chris Reed. This is Chris Reed and his fiance and their 2 sons. Chris Reed told Jim Newton in an article in the Chicago Tribune titled 2-time heroin overdose survivor, posted July 16, 2019, that in 2008 he was looking for an escape, and that escape was heroin and Xanax, which led him to his first overdose in 2019. And then shortly after, he had his second. He has now been sober since September 20th, 2009. As it gets harder to listen, you now have a better understanding of how we can be a part of, or how large of an epidemic it is that we're facing, how we can be a part of the solution, and why it's important that we face it. Now I want to share with you my challenge for each of you. My first challenge is for you to use your at-home disposal. You can refer to ghs.org, but these are a few steps that you can take to do at-home disposal. That article was written by L. Reynolds on Prisma Health, titled Spring Cleaning for your Medicine Cabinet on May 2nd, 2008. My next challenge for each of you is to visit takebackday.dea.gov to learn about when the next National Take Back Day is. My next step is to visit getsmartaboutdrugs.gov to learn how you can participate in the National Prevention Week that's coming up right around the corner. As I end, I want each of you to remember the 4 key points: how large of an epidemic it is that we're facing, how you can be a part of the solution, why it's important that we face it, and my challenges for each of you. The opioid crisis can easily affect you or someone that you love if we don't step in and do our part. I want to leave with each of you with something that maybe will motivate you to do your part and to step in. And it comes from what I found on Overdose Lifeline Incorporation, titled Remembrances. My hopes in sharing this is to motivate you and move you so that we can step in and do our part in honor of those that suffered and lost their lives because of an overdose. Anthony, 22, Nick, 20, Joe, 22, Alicia, 27, Martina, 25, Mark, 28, Terry, 26, Leah, 19, Dalton, 19, Megan, 22, Scott, 50, Cole, 24, and one of my childhood friends, Katie, 23, and one of my sister's childhood best friends, Jessie, 18. Thank you.